All right, Amber. So first off, thanks so much for doing this. My first question to you is tell the audience a little bit about yourself and how you started in the community.
Sure. So I'm a a licensed clinical social worker. And I live in outside of Philadelphia, Pennsylvania. I'm licensed in a few different states, Florida, Delaware, and New Jersey. And I provide in-person and virtual therapy. Um, I have a practice. It's called Collective Healing. And at my practice, I primarily work with individuals and families. So a lot of adolescents, adults, um, sometimes children, and also families. Um, yeah, I mean, as far as populations go, I don't know if it's helpful, but I work with eating disorders as my specialty. And then I also work with just more general mental health. So just more like anxiety, depression, people with transitions, different relationship conflicts. I'm pretty general in that aspect of trying to support the community with mental health.
hmm What got you interested in the in with the family systems?
hmm so I would say, I mean, I've always been interested in psychology. I think in general, I've always known about, I think myself that I really love to help others. And I'm very much a people person, good communicator. Um, I think I really pride myself on like relationships that I build with other people. And so I think that becoming a therapist made sense for me, um, given that I could help people in a different way, that wasn't like medical or something, it's actually something that felt more natural to me, and more of like what I wanted to do. As far as like how I kind of, maybe got into like family systems work, was probably more around I would say like in graduate school, in social work it's a pretty broad field, and many social workers don't really get trained in family therapy really. I did have the opportunity to take a class in it, but was also just interested in family work because my specialty is working with eating disorders, and a lot of times that diagnosis often really affects the family system, and family members are usually, the ones that are caretaking or supporting the person with the eating disorder, and they play a large part in the recovery process. Um, so, I think just from that aspect, and like I'm a parent myself, and I definitely feel comfortable in the family system in general, working with parents, caregivers, siblings, really, um, you know, the whole group.
hmm So my next question is what sorts of modalities do you focus on in your practice? Because I'm sure you've heard of CBT and all that uh relational therapy and all those kinds of things, but particular to your practice, what sorts of things do you focus on?
Sure, sure. So at my practice, I think I focus a lot on so I think my approach is very relational. I am very, I think, authentic with clients. I think I try to have a good, a pretty close relationship with them. So building rapport is important, because I understand that they're sharing a lot of vulnerabilities with me, and I want to, um, I want to be able to go deep with them, really, and to be able to help them gain insight into, parts of their life that are that they're struggling with. As far as approaches go, so I do a lot of, so with eating disorders and working with adolescents, the gold standard of treatment, it's called family-based treatment. And it's, one of the only evidence-based treatments in working with adolescents. And so that kind of involves a lot of working with the family system and honestly in a different way. It's kind of helping the family help their child and really empowering them through parental involvement and really helping them restore like weight patterns or I'm sorry, like eating patterns and weight restoration is a huge part of it. And then kind of uh, including the adolescent in kind of collaborating and with the family and kind of helping them recover. So it's kind of done in like a few different phases, but so I'm used to doing that, which honestly is really helpful for the family because many parents are nervous about sending their kid to maybe a treatment facility or um, maybe they feel like they have a lot of resources to be able to help their child, but they just don't know how. So that's like one modality that I use a lot. So I'm working with a lot of teenagers and children. And I'm working with the parents really with that one too. Like I'm doing a lot of coaching, I'm doing a lot of supporting the parents with their emotions and helping them honestly get their child better. Um, some other things like, I do too. So like I practice a lot of like emotion focused therapy. So I'm always helping people gain insight into their emotions. That's really at the core of a lot of eating disorders and a lot of mental health related concerns. So, always helping people identify and label and validate their emotions and having awareness around the normalcy of emotions and helping them connect their emotions to their needs. Um, I do a lot of like CBT, like cognitive behavioral therapy. So, a lot of that is, kind of challenging, thoughts, behaviors, patterns that impact the behaviors, and then trying to replace them with more effective thoughts, feelings, behaviors.
Mm-hmm.
So, those are just some like, I recently got into like, it's called EMDR. So it's like eye movement desensitization reprocessing, and that's mostly working with a lot of trauma, and helping people reprocess trauma in a way that feels safe in their bodies and feels, um, feels a little more integrative in the healing process. And just a lot of like skill building, DBT, ACT, and I do a lot of like exposure work. So like really kind of on the ground work where I'm with the client in a grocery store, I'm with the client at a restaurant or doing different exposures to help them build more tolerance towards their fears.
Mm-hmm. Because what I was gonna ask is like, how do you sort of, because you work with people that have a wide eating disorder, so like, how do you sort of model that within the therapy room to like have them sort of share their struggles and to sort of like have them sort of really find ways to sort of cope with that or like deal with those issues? How do you
Mhm.
sort of model that in the therapy room? What does that look like? What are the sessions like?
Yeah, yeah. So honestly, I think when working, maybe specifically with eating disorders, like a lot of it is helping them, target symptoms and behaviors and helping them decrease those symptoms and behaviors, we can do that in one of a few different ways. Like I usually will use like a harm reduction approach with clients because I understand like abstinence isn't always that easy when maybe we've been engaging in behaviors for a long time. So just help kind of meeting a client where they're at, and helping them, gain coping skills and insight and awareness into their behaviors. So I do a lot of like, sometimes it's honestly, sometimes I do a lot of modeling. Like I tell them, I share things that, I've found helpful, not with an eating disorder, but, just coping in general. Like, what does that look like from a realistic standpoint? Um, because sometimes like coping skills and the terminology can, I think, be a little intimidating for clients. So just teaching them that like, I have maladaptive coping also, and I can, right, like, and we can do things differently by, changing the way we respond to things. So like, I think going through and finding out like one, like, I guess like some of their interests and hobbies and then kind of bringing that into like how can we engage in those things more and what's going to help us foster our identity versus these behaviors and like what aligns with our values. um like what these behaviors typically don't align with our values, so like what's really important to us, what do we really want to do with our time. So, I think that's a big piece. I think also just like kind of, um, I do a lot of like kind of checking in with them and like helping them process their emotions about certain situations. Some of that is helping them learn how they feel about the situation. Sometimes clients are brought up in families and family systems that aren't always validating or weren't always maybe accepting of emotions in the home. So sometimes it is like providing clients with a space where they can receive support, empathy, validation, like me normalizing that makes sense that you feel sad that this happened. And I think they're able to kind of shift out of, I think these more negative thought patterns that they might have had before. Um, so yeah, I mean, just some of that, like I think I bring myself in the room. I definitely, I'm very engaging with them, very active in session. I'm definitely not like a nod my head therapist. I'm, engaging in almost like a conversation with them and, finding out what's going to help them.
Mm-hmm. Yeah, because my next question was going to be like, how do you sort of, because you said earlier that oftentimes you would, in learning how to cope with these eating disorders, you would take them out to grocery stores and things of that nature. So how important is it to, for those folks to have sort of the exposure to really, um, help them sort of walk them through how they can sort of uh navigate navigate the complexity of an eating disorder. I'm not sure if I'm asking this right, but
Yeah, yeah. So, I mean, I think exposure work is really valuable because, when working with these clients, we're really working around their fears and vulnerabilities. So, and I think that usually these behaviors have been reinforced over time through how we have responded to those situations. So, for instance, maybe we right, like maybe upon having it, the onset of an eating disorder, maybe there are certain foods that we sort of cut out from our diet, for instance. Maybe it's carbohydrates, maybe it's typically maybe it's desserts or something like that, right? We sort of have trained the brain to believe that this is something to be fearful of. Um, and so reincorporating those things back in, um, is scary for a client, right? If you measured their anxiety about it, it would be pretty high. So the only way that we can kind of lower that anxiety is by exposing ourselves to the things we fear the most. And part of that is allowing people and bringing people into those emotions and allowing them to tolerate and allow them to sit in those emotions and also equip them with coping skills to know that, this isn't something you need to be fearful of. This is the narrative, and this is really the context these foods are in is fear. And so we're like retraining the brain and kind of exposing them and continually exposing them until their distress comes down and they do feel like they can tolerate that food a little bit better or that situation a little bit better.
Mm-hmm. My next question is, like, what have you learned in working with, in doing this kind of work specifically within the family systems and those with eating disorders? Like, what have you learned in working with that population? And also, kind of to add on, like, what do you hope to learn, like, in the future? Who do you want to, what do you want to learn? Like, do you want, what sorts of new things do you want to learn to sort of add on to, to try new things, that kind of thing?
Hmm. Yeah, yeah. So I think what I've learned about these, I think this population, is that like, um, hmm, yeah, that's a good question. I think what I've learned is, that I think one, like eating disorders are becoming more prevalent. Um, and I think that they certainly look different as time goes on. I think, there's a lot of complexities underneath of an eating disorder. You're rarely working with just the food. It's not about the food. That's very much I would say a stereotype maybe, or the public perception. You're working with, gosh, trauma, family conflict, anxiety, depression, um, everything except like, I think the food is the superficial part, and the body image is also the superficial part. So it's like when I think I've learned that there's so many layers to working with those clients, and honestly, like I find them to be really resilient. And I think that's what kind of keeps me working with them, is because it feels like, I uncover one part and then there's more layers to go. And that's what keeps me kind of, I think, curious and compassionate in the work. And yeah, I mean, I just have a heart for those people, definitely. Um, as far as like, I guess what I hope to learn in the future, that's a great question. Yeah, I mean, honestly, I recently have started to, I think in the beginning when I started my practice, this was about 3 years ago, I was more so niching, it was more of like I'm more general. I work with, pretty much anyone because I'm a social worker, but I like working with eating disorders, right? And then recently I've been more so niching into eating disorders and opening my door to like other people, like, but really trying to focus on the work that I know that I do best and that I'm really passionate about too. Not that I'm not passionate about the other people, but you know what I mean. So I'm working on other modalities. I think treatment modalities, and that's more of like what I always am working on in the future, is like continuing to educate myself, becoming trained in different modalities because I really want to be well-rounded. So I think like EMDR was the newest thing this year. Family-based treatment was a few years ago. What I hope to, kind of get into next is more of like maybe like accelerated resolution therapy or, maybe some somatic work, involving the body a little more in the treatment. So yeah, but I'm open. I'm really open to learning a bunch of different things.
Mm-hmm. My last question to kind of wrap this up is like what can other professionals who are entering the mental health realm who want to study eating disorders, what can they sort of what can they sort of, learn to sort of be more prepared to tackle on this specific um this type of type of population, specifically those with eating disorders, because I get that eating disorders affects not just one group of people, it affects everybody with regardless of race, ethnicity, gender. So it's a whole, it's not one specific population, it's very general, I would say.
Mm-hmm. Yeah, yeah. I think as far as what people can equip themselves, maybe, or like maybe these are things that I wish I would have known, who knows? But I think definitely, I think family systems work is so important in working with eating disorders. And I think also, yeah, I think like I think being prepared for complex cases, I think it's good to be well versed in a lot of different modalities because a lot of pieces show up sometimes in that work. And I think like with family systems work, I think oftentimes a lot of clinicians are very, unless you are a marriage family therapist, I think that a lot of clinicians are sometimes hesitant or maybe like even avoidant. I've experienced that where, they, it's almost like they think that recovery stops with the individual. And really, like when you're feeling stuck, the family can almost be an ally, and the family can also be like they're not the problem, which I think is how they were framed in the past. Like they really are part of the solution. Um, and so they can be like, sort of your greatest asset in helping an individual recover, whether they're an adult or an adolescent. Um, so definitely including the family and I think like, the other thing I would, I guess recommend is also just like learning about your own relationship with food and your body. I think when working with these clients, I think honestly, a lot of the work is sometimes modeling for them what is normal and healthy, and what is balanced. So, I think kind of like recognizing like your own views on food and bodies and I think like uh examining kind of your own attitudes about like diet culture and like, um, weight stigma and things like that. So, I mean, I'm sure I have more, but those are just kind of the ones on the top of my head.
Yeah, because I was talking to a PE teacher of mine from elementary school that I knew, and she said, you know, like, oftentimes when it comes to really figuring out what to eat, it's basically a choice that people can make. So it's not forced in a way. It's people's own individual sort of choice in how they want to navigate their own lifestyle and conduct their own lifestyle.
Yeah, yeah, I agree. Yeah, I mean, I think it's learning a balance, but certainly there's lots of clinicians that I think have maybe their own journeys with disordered eating or an eating disorder, and it's important to be mindful about, how that work shows up with clients. Um, because certainly this is something that these people are very like hyper vigilant about, or like kind of what has contributed to their disorder. So I think it's just being mindful and being aware of that.
Mm-hmm. All right.